People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life...
Darling, what's for dinner?
love...
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Hello, can I report it to recess for a transfer, please? Hello, can I report it to recess for a transfer, please?
Hello! Hello, Anne! Did you just say hello?
Hello.
What's up?
Hello.
What's up? Did you really just say hello? 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 You speak to my friends that I went to school with, they just go, "You, a nurse, what?" I didn't get a cup of coffee, it's too late now, it's your fault, and I'm gonna be grumpy. Even my nurses, when I qualified, they were like amazed I passed. I'm not thick, but they, yeah, even my nursing school were amazed.
What are you moving all these chairs about, Sophie?
Because they don't, if you get trauma, you don't need a chair in the room, you've got to be prepared. I was abandoned as a child, and so the first people I probably interacted with nurses. So I've kind of got to the thought that maybe that's where it's come from. It's rewarding. Acknowledge people. I think people want to be acknowledged. Good morning. You might have seen it 500 times, but to that person, it's the worst thing that's happened to them, regardless.
Is it bad? I haven't looked at it. Is it bad? I haven't looked.
It looks good.
It looks good.
Yeah, it's a nice injury.
But we do see a lot more men, strangely enough. They just don't think it through. They just go all the way to like, yeah, I'm gonna get the best table saw in the world and then cut their fingers off.
That's the worst bit.
Okay.
They get very enthusiastic about things. They go right to the end.
Worst case scenario.
I'm going to lose my thumb, am I?
Oh, no.
Okay.
No.
George's. Yeah. Okay, and they're still. You're going to call in 10 minutes out, is that right? All right, okay. Thanks, bye. Hi, can you put an adult trauma call out for any recess? Yeah, cheers, bye.
A cyclist has collided with a stationary car in Surrey, sustaining a severe head injury.
I think it is the speed of the bikes now. They go so fast. When you get serious injuries, you can still get head injuries. If they've got pressure in their brain, then it can go to the point where even if you relieve that pressure, there's nothing you can do. There's still, we can still not save people with certain head injuries. It's just not going to happen. So you check the suction. Suction's good. Good. ABC. Here comes the peer shockers.
It's just a salvable tissue from the accident. It's part of his little nose. Part of his nose? Yeah.
So we're going to go slide.
Okay.
Ready, brace, slide.
Just take that hand from him. Put it in a blue tray or something. What's in there? Hi, sir.
This is Dave. He's a 53-year-old gentleman. Cyclist versus stationary car, travelling about 20 miles an hour. He described the accident. He basically looked down, looked up, down straight into the back of a hatchback car. There was quite significant damage to the top of the hatch where he impacted. As you can see, he's got a significant max injury, and obviously there's a remnants of it.
Disconnected at the bottom.
Okay, well done.
Release collar.
So this, we're coming, let me match that, because this piece missing. So it's gone right there.
Having sustained significant damage to his face, doctors are also concerned Dave may have suffered injuries to his head and neck.
Do you belong to anyone, sir? Wife? Do you have family?
Yeah.
So hopefully the police will let them know, okay? Yeah.
The police has got to get all right.
Okay. Oh, okay, fine. So she will let her know, okay?
I didn't have any bad feeling. I knew we were going out for lunch with some friends, so I just said to him, just make sure you're back before we're due to go out. But I always said to him when he went out, just be careful.
Yeah, he's got some double vision on damage and lateral gaze on the left side.
Just going to try and take some blood out of this side.
I remember the phone ringing, and it was his friend Bugsy, who he'd been cycling with. He just said to me, there's been an accident, Dave's come off the bike, and an ambulance was on his way. Your mind plays tricks with you when you've got news like that. You have worst case scenarios, best case scenarios. It's probably okay, it's just a bump, or oh my God, he could have broken his neck.
We're going to scan them?
Yeah.
Yeah, but you don't know what the rest of his spine and things are doing.
It was when he said he's lost part of his face and we've got it on ice. That scared me a lot.
Scan ready?
Yeah, scan's ready.
Beautiful.
53-year-old biology teacher Dave has crashed into a car on his bicycle. Due to the damage to his face, staff have ordered a CT scan to identify further injuries.
Ready, brace, slide.
Too much?
Good stuff.
Dave's wife, Kate, has arrived at St George's with her sister.
We met in the Freshers' Week at St John's University in York. Dave was in a pair of flared jeans and a cardigan. I think his mother had knitted him, so yeah, he looked interesting. I just remember him saying, "Do you want to dance?" And I said, "No, I've got a really sore foot." And then he said, "All right, do you want a fag?" And I said, "Yeah, okay." So we went outside and had a cigarette together. I knew very, very quickly that he was the man for me. I knew that. I don't know why. I just knew. We've been together nearly 34 years. Quite a long time. I can't imagine Dave not being in my life.
I'm ready, brace, slide.
That's one step too far for me. I just wouldn't let myself think like that.
'Just thinking about evolution, actually. You see evolution, and like how we used to eat raw meat. We didn't used to wear shoes. Our feet were able to tolerate that sort of rough ground. We may have moved off from our instincts, yeah, and became a little bit more intelligent, but
we and ourselves actually became weaker.
Yeah, exactly.
Humans got shit.
Yeah, man.
30-year-old construction manager Richard has come into urgent care after injuring his thumb while cycling.
Oh yeah, how you doing, all right?
Yeah.
That's all right.
I'm Helen.
Hi, Helen.
Nice to meet
I'm
you.
Rich.
Nice to meet you. Can I just have a look, please?
Yeah.
What happened?
I came off a push bike, Boris bike, good old Boris. So
What do you do for a living?
I was in the Marines and yeah, left and then set up my own company,
Okay.
building company.
Now, we're going to X-ray it.
Yeah. Okay.
I'm going to give you some gas.
I can hear everyone else raving about this gas stuff.
Oh, the gas stuff is
Well,
great.
Great.
Start now, yeah?
Deep breath. Yeah, you can do, yeah. Is it painful at the moment?
It's just numb.
Just numb.
It makes the voice sound funny as well.
It's like a helium balloon.
When I was about 5, I remember going on holiday with my parents down to Dorset and watching the Royal Marines do an exercise on the beach there, and they were all jumping out of helicopters and jumping off boats, and I thought, wow, that's amazing. I sort of turned to Mum and Dad, I was like, Mummy, Daddy, who are they? And they're like, oh, they're Marines. So I was like, yes. I knew pretty much there and then that's all I wanted to do.
This is amazing. I should come to a hospital more often.
I joined when Afghanistan was kicking off and becoming quite a big operation. But you went into it thinking, yeah, this is really exciting. You know, edge of your seat stuff. Maybe I'm quite an adrenal person. Love surfing, skydiving, mountain biking. I think it's just the way I am. I'd get quite bored and probably a little bit unhappy if I wasn't doing those. Certainly challenging myself and pushing myself.
All right, brother.
All right, how you
Yeah,
doing?
man. Good, good.
You good?
I'll take you on for X-ray, yeah?
Okay, brilliant.
You like it, innit? Yeah, babe. You like smoking weed, eh?
Like smoking weed, innit? Just pieces you out, like.
Yeah. Mellow.
Is that where you're from, Jamaica, is it?
Yeah, man.
Yeah?
Yeah, 12 years from I live in England.
Yeah?
But I still can't change my accent.
No, that's good.
Yeah, man.
It's good, is it? Nice and chilled?
More chill back, man. Trust my blood. No rush.
Do you cycle a lot?
No, I just got the damn
Have
thing.
you?
I had it all week. Trying to lose some weight.
Oh, there you go, so. So I think your fitness days are gone.
Father of two, Dave, has severe lacerations to his mouth and nose. He's awaiting the results of a CT scan to reveal any possible internal injuries.
Oh, cool. Come this side.
What the...
Come this side.
Doing?
Here's a chair for you.
You silly man.
Don't make me cry.
When we first met, he was a bit of a character around university campus. And I know that some people thought, you know, oh, you know, he's a bit, you know, he's a bit of a one. But actually, there was a side to him that I saw that perhaps not everybody saw. Behind all that sort of bravado, there is a shyness to him, a slight vulnerability there. Yeah, I think that is something I found quite attractive.
I looked down for about a split second.
What the greatest concentration span in the world anyway.
I don't know, I think that was a problem.
I always knew Dave would be a good father. When our son Matthew was born, I've never seen Dave so emotional, I don't think. He was just overwhelmed with it. And I just remember him saying to me, I'm so glad I married you.
Scans are normal, which is great.
Oh.
Right.
Dave's CT scan shows no further injuries. Plastic surgeons have been called to resus to assess the damage to his face.
Feeling a bit better now? Sat up?
Yeah.
Good, okay. Yeah. This left side of your nose, you've lost skin from the nose around the bottom here.
Yeah.
Now you're left with a defect, as in some missing tissue. So one of the best options for now is just to close what we can and then plan reconstructive options down the line. But it's difficult for us to say 100% what it'll look like.
Okay.
You all right?
He knew this was quite serious. What if he's lost part of his face and it isn't reparable? I think he was really frightened. I've never seen him like that before. Never. Don't worry, love.
How are you?
Would you like a minstrel, sir? There, chocolatey. Do you want a minstrel? They're tasty, man. You're missing out.
I didn't see the chest. Does the chest look... can you show it to him? Consultant Will has just started his shift.
I've got to go back to mine.
Today, he will be working across all 4 areas of the emergency department.
I was in A&E quite a lot as a kid. Yeah. I played quite a lot of sports. I kept breaking things. I fell out of trees.
What is all this bubbly stuff?
Edges. So that's fat.
Oh, thanks.
Or subcutaneous tissue. That sounds better. Everybody takes risks all day, every day. I've got a little 50cc scooter. So yeah, you see, now it's going to get bad, isn't it? So I put the kids on the back of my moped. Beautiful. They're usually screaming, go faster, Daddy, go faster. Can we do a wheelie? No, they're not. Job done.
Nice. Thank you.
But there are calculated risks that we take. Most of the times you get away with it. You learn from it, and your experience and your achievements will go up. But every so often, when you challenge yourself, you fall short. Hello, St George's. Okay, go for it.
A 19-year-old motocross rider is being transferred from a hospital in Brighton to St George's.
Thanks, mate.
He's been thrown off his bike during a race and suffered multiple spinal fractures. He will need to be treated by St George's specialist neurological team.
Whenever we have a potential spinal injury patient coming on, we realise that's a real time-critical injury. If they have paralysis at that time, we have to diagnose why they have it and see if there's something that we can reverse. We're ready now. But unfortunately, spinal injuries, there is a higher possibility that this won't get better.
Yeah. Hello there. Hello.
Is this Billy?
This is Billy. Are we ready? Set. Go. Well done, buddy.
Hey, Billy. I'm Will. I'm one of the doctors here. We'll get you off this hard board very shortly. Okay, buddy?
Basically, at about 4:30 today, Billy was on his off-road motorbike. He came off. It was about a 20-foot fall onto the ground. He's essentially managed to sustain himself several
thoracic spine fractures.
Spine fractures, T6 to T8. He's completely insensate and no motor function from sternum down.
It does sometimes heighten the level of the anxiety within the team. Just thinking as a young person in front of us whose life potentially will completely change now if their neurology stays as it is.
Having lost sensation to his lower body, A&E staff will need to fully assess Billy's condition before referring him to the neurosurgical team.
So, Billy, what we're going to do is the neurosurgeons are expecting you here, and they'll be on their way down soon to come and have a chat with you and assess you, OK? Is there anything you want from us at the moment?
Not really, my back is hurting quite a bit.
Do you want any more painkillers?
Yeah, if that's OK.
Yeah, so we're getting some more morphine.
I already had children. Billy was my third. He was such a happy baby as well. Really good baby. From an early age, he's always messing about with cars or motorbikes. He was about 6 when he first started competing in motocross, and it was just his world.
Sharp scratch.
Every other weekend, it was motocross, and we've been doing that probably for about 15 years, really. He went to college and did car body repair course, and he absolutely loved his work, absolutely loved it.
We'll just re-bleed him as well, so we've got a set of bloods. We've got his scan, we've got the report.
We was standing watching the race. He was just coming round past virtually where we were standing, and he just all of a sudden come flying through the air. Didn't really realise it was him until I see the bike, and then realised what bike it was.
I knew that he'd hurt himself. And the paramedics were there straight away. And one of the first things he said to me is, "Mum, I can't feel my legs."
But I don't think they're the kind of band that sings live.
I think Ronan Keating could sing live.
I don't like his voice.
I like Ronan.
But I do like it in Notting Hill.
Oh, that's a lovely song.
gas run out? Thanks.
Ex-Marine Captain Richard has injured his thumb falling off a push bike. He's awaiting the results of an X-ray.
Right, Sally. Here's my finger. So shall we put it back? Yeah. Come on. Pretty good. It's impressive.
Is it?
Yeah.
It's a good one.
It's a good one. It's completely off the top of the joint.
Really?
Yeah.
So we're
going to put it back.
You're going to put it back, are you? I knew you would. I knew you would. She's a star.
The experiences you have in the Royal Marines, faced with severe injury or death, there's definitely a real dark humour. There was a group that we worked with in Afghan, and quite a few of the lads got tattoos done around their leg with a dotted line and a pair of scissors. And so that's very dark to an outsider, and you think, wow, that is sick. But actually, it's a really effective way of dealing with it if you can laugh off what are some pretty tough moments.
Just going to turn your hand, Rick.
That's it. Nice deep breaths. Well done. Nice deep breaths.
You all right there, Rich?
Okay.
Yeah.
You sure?
Yeah. Motherfucker.
Sorry.
No, take some more. Take some more.
Deep breaths.
Is it not going back in?
We haven't got anything to work with. Normally your tendons and muscles and that would hold things in place. There's really nothing holding that bone, so we've got no leverage. All right.
No worries, all right.
I think the Marines does train you to deal with hardship and fear, but I think even the most seemingly fearless person certainly is going to have some element of fear in their own mind. And I think that a bravado, puff out your chest, doesn't bother me, when actually, yeah, under the skin and under the humour, and you peel that back a bit, you're as scared as anyone else.
So I won't make it to the pub now?
No, to tell you an epic story.
I mean, there's literally nothing. There's got no tendons, muscles, or anything holding it. It's a loose end, so there's no way you're going to...
That's going to have to be wide, isn't it?
Need some kind of surgery. Yeah, I don't know what they would do, to be honest. Oof. Yeah. That's it.
It's been 3 hours since Dave crashed his bike into a car.
You're right.
Okay.
Okay, I'll see you in a minute, darling.
Plastic surgeons are preparing to close Dave's wounds under local anaesthetic.
Okay, we'll start down here, just putting the leg in. Just get you to turn your head around a little bit. Sting a little bit.
They tried to bring the skin in.
Yeah, but it's no use. It won't. There's no real value in it. Once it's off, it's off.
A little bit of fitness.
Is the bike all right? No. Yeah, that's good.
I wouldn't say Dave's very cautious, no. He's not the kind of guy that you can go on holiday and lie on a beach. He's more throw himself down a mountain on a set of skis. He's not kind of fear, no, not at all. I think it was probably a wake-up call for Dave. As you're getting older, you can't take those sort of risks, and you realise you're only mortal.
Oh, that's better. You're right, sweetheart. Yeah.
So the lip's all done.
Oh, yeah. All right, darling.
Right, you're going to be sore, remember? Just from life. Well, no, but do you know what I mean? Just from what's happened, you know what I mean? Sometimes you go, oh, I'm stiff.
Yourself.
Yeah, this is a big bump, and you'll find bruises where you never thought you had bruises. Be careful. I think that people are doing more to get something out of life. So you've got to try and push it to get the excitement. And I believe in fate. Some things happen. Some people get away with stuff, then other people don't get away with stuff.
Dave is being discharged, but will have to return for surgery to his nose.
it slowly dawns on you that you've actually really hurt yourself. Just to think you've put yourself in such a dangerous situation. You try to just constantly evaluate, why did I do that? How did I miss that?
Yeah, might as well. Why walk when you can ride?
And I think what dawns on you is that you've absolutely no control of the situation at all.
Hi, we're just coming out.
And that makes you a little bit more philosophical about it. And it makes you realise you are quite vulnerable, really.
Thank you so much.
That's all right. Take care.
And perhaps, I should take life a little bit easy. Maybe I'll go back to golf and fishing, and that'll help.
Can you just turn the time out for me? It's going to be a bit of a cold flush. I know we're attacking you from all angles right now.
Yes. It's been like all day.
It's been like that all day. You cold?
No, I ain't too bad, to be honest.
You ain't too bad?
19-year-old Billy has come off his bike during a motocross race. He's lost sensation from the chest down and is waiting for neurosurgeons to assess his CT scans from Brighton Hospital.
I wasn't even going to race today.
You weren't going to... Were you in a race?
Yeah, I do racing.
Competition?
Yeah.
Out of all my children, Billy has always been the most loving. When I used to say goodbye to him at school, he used to turn around and say, I love you, Mum, always. But when he was about 9 or 10, he went through a really bad period. I don't know why, and he ended up getting expelled from his junior school, and he ended up going to a naughty boys' school.
Every day we had the school on the phone, can you come and collect Billy? Billy's on the roof of the school, can you come and get it? Don't know how he got up there. I think at the time me and my wife had got along to the school. He'd got back down and run off up the road. The police was looking for him.
Having travelled from Brighton, Billy's parents and 2 brothers have arrived in Resus.
Oh, mate.
Mm-hmm.
Yeah.
There we go, lovely. I'll get some chairs.
Your face is bruised and not...
Oh, I'm knackered.
Look like you're smacked with a bat, mate.
Oh, yeah, it does, doesn't it?
My nose hurts.
Your nose?
Yeah.
That's all bruised, all down the front. Looks like you're broken.
Yeah,
You've got a black
yeah.
eye, all up there is all bruised.
I've got 3 boys. They love fast sports, motorbikes, cars, jet skis, banger racing. That's the type of boys they are. I didn't discourage them from doing anything, what they wanted to do. The main thing I didn't want my boys to do was to ride a motorbike out on the road. So I got them into riding motocross bikes over the fields where we live at first, and then we got into it really in a real big way.
Got a headache.
I bet you have, little baby, mate.
I think it was good for him to have a hobby. You know, it just gives him something to aim for. But looking back on things, I think, oh, why did he have to get into motocross?
I can't feel them.
It's so difficult. You can't wrap them up in cotton wool and stop them from doing things they absolutely love.
Cyclist Richard has been in A&E for over 3 hours after seriously dislocating his thumb. Specialist plastic surgeons have been called to decide whether he will need surgery.
Thumb, yeah.
That doesn't look like it's in a good position, does it?
Yeah, it's not quite in the right spot.
Why would you mind if I had a go?
Yeah.
You seem like quite a stoic chap, so.
The whole
thing,
yeah.
Well done. Okay. Right, that's not going to happen. No.
It's not going in.
It's not going to go in.
One last try.
No. So anyway.
Yeah.
The plan is to take you to theatre.
Okay.
My mum said something really interesting to me, actually, when I left the Marines. Rather than, oh, I'm so relieved, you know, she said, but how are you going to get your thrills in life? How are you going to get your excitement in life?
We may need to keep you in tonight.
Okay.
All right?
All right. Is what it is.
I think it's probably something in sort of male, you know, body or ethos or DNA that you want to strive to take risks, because I think in an evolutionary way that those people who took risks would possibly get reward from those risks. On the inside, you might be, you know, really, really nervous and, you know, quite scared about what you're potentially going to go and do. We still crave that kind of adrenaline.
No, we need to get you up. We're going to
Bye
take
bye.
you on the
Bye-bye.
chair, okay?
Come, if you're feeling well, I'm here tomorrow. Pop down and see me. Let me know how you got on.
Okay, will do.
All right.
Keep my eye out.
In perverse fashion, the closer you are to death, the more alive you feel.
Thanks, Dave.
Yeah.
Take care, okay?
Thanks. Take care. Cheers.
You feeling okay?
Fed up now.
Yeah, I'm sure. Do love you.
It's been over 8 hours since motocross rider Billy suffered his accident.
Hello, recess. Hello. Are you aware of this chap called Billy? You are.
St George's neurosurgical team have reviewed the CT scans from Brighton.
I mean, he's had a pan scan from head to pelvis that has been reported at Brighton as this T456 injury. Yeah. Okay. Yeah, no. Okay. Thanks, mate. Cheers, bye. In this case, we knew that there's obviously damage to the spinal cord. Once you've damaged the cord, it's very rare for the cord actually to regenerate. And so we know at that stage that the high probability is that this is going to be a permanent injury. It's one of the downsides of our work. You know that more than likely he's going to be paralysed for the rest of his life after doing something that he loved doing. And you know, how he's going to cope with that, and his family, etc., are going to cope with that. I'm just going to talk to Israelis now. Hello, Billy's family?
Yeah.
I'm Will. Hello, mate. Hi, I'm Will. I'm the A&E consultant here. I'm sure, are you fully aware of what has happened and why he's here? And he has this injury to his spine, and that you understand that he can't feel and move below about here.
No, yeah, the minute.
Was that immediate? Was it immediate?
Yeah,
Did he say,
was.
I can't feel my legs? And okay. When it happens straight away like that, it implies that there's been a damage essentially to the cord itself, rather than something from the side pushing on the cord.
Right.
That is an injury that's happened to the cord there and then, which is a significant injury.
Yeah.
And whether it's reversible, I think at the moment it doesn't look great when it happens so quickly.
Yeah.
I just didn't believe it. I wouldn't. It's as if they're talking about someone else. You just never ever expect it to happen. Not to yours.
All right.
Okay.
We're get checked out and then you can come in.
Okay, thank you.
All right, Billy.
In my heart, I knew, but I didn't want to hear it. They said his injury, they've called it T4 complete. Complete means there's no chance of ever regaining feeling again. It's almost like a sense of loss. It's really difficult to explain. And anger, I think, because that's how I kept thinking, why? Why Billy? Why does he deserve? Why has this happened to him?
All I kept on saying was he'd be okay. Someone's going to walk in the door and say, oh, we found this... we found this cure. Would you like us to test it on Billy? And everything's okay.
Where them I do, where them I try, where them I say.
Hello, Resus. Yeah. We're happy for him to come up if you are. Thanks, mate. Cheers, bye.
Billy is being transferred to intensive care. He will need surgery to insert supportive rods to stabilise his spine.
We've had our own crying and we're never ever going to accept it, but it's happened and we've got to make Billy's life as best we can give him, really, for the rest of his life.
I think you just have to deal with it in your own ways. It's so difficult. But life has to go on.
I'm proud of Billy for how he's coped with this. Really, really, really proud. He's never going to forget what he's done, but he will live his life how he wants to live it, and I'll be right behind him to do whatever he wants to do.
We're all gonna be there for him as much as he wants us to be. That's all we can do, really. Just show him we're there. You think it's the end of the world, but it's not. I've still got him. He's still here. He's still my son. Whether he can walk again or he can't, I've still got my son. He's still my Billy.
To me, he's gorgeous. He really is. I think he's really handsome. With or without a nose.
I'll find another way to get a little bit fitter. I've got a bike in the garage, actually, like a static bike, you know, an exercise bike, and I think that's as fast as I'll go.
I've always wanted to be the best at what I do. It's like people say, don't push yourself too far, but it's something I've got to do, I think.
Really? Yeah, lean forward.
Everyone's got to push themselves, otherwise you'll never achieve what you want. Some people are scared to take risks because obviously, yeah, life is precious, but you've got to live. I don't regret my accident whatsoever. If I could get on a bike tomorrow, I would. I've always been looking at different things I could do. I had a few ideas. I was talking about if I can't do it on 2 wheels, I'll be doing it on 4. Like in a car or something. I've always wanted to try drifting in a car. Might as well try something new. Another challenge, something else to learn.